Hello everyone. Today's topic is joints of the pelvis. Pelvis is made up of four bones: two hip bone, also called as the innominate bones, sacrum and coccyx, and all these four bones bound to each other by the ligaments. So joints of the pelvis and ligaments is our topic today. Now joints of the pelvis are the pubic symphysis, that can be seen in the median aspect, anterior median aspect between the two pubic bones, and posterior aspect on each side between the sacrum and ilium, right and left sacroiliac joints, and in the lower part posterior aspect between sacrum and coccyx there is a sacrococcygeal joints. So these are the three types of joints can be seen in the bony pelvis. Another joints that form with the bones of the lower limb, that is between the hip bone and the femur bone. Here on the lateral aspect there is a formation of hip joint between the sacrum, acetabular and head of the femur. Now first we discuss about the pubic symphysis. So this radiological picture showing the pubic symphysis in the median part, the two pubic bones, right and left sacroiliac joint, and the posterior part there is a posterior part there is a sacrococcygeal joint. Now pubic symphysis, it is a secondary cartilaginous joint, and it is formed by between the body of the two pubic bone. Now this margin of the two pubic bone are covered by the hyaline cartilage. In between these two there is a presence of fibrocartilaginous disc. So articular surface are covered by a plate of hyaline cartilage, which are then united by the disc of fibrocartilage. And then joint is surrounded and strengthened by the fibrous ligaments. So here there is a superior aspect as well as inferior aspect. Superior and inferior pubic ligaments are there. So inferior pubic ligament is also called as the arcuate ligament. This one is the arcuate ligament, and it is very strong ligament. It is a secondary cartilaginous joint. Now next to the pubic symphysis, sacroiliac joint. They are generally described as a plain type of synovial joint between the by the union of the auricular surfaces of the sacrum and ilium on each side, right side as well as left side. Sacroiliac joint is surrounded and strengthened by the four types of ligament. That is intraosseous sacroiliac ligament, that is attached here, intraosseous sacroiliac ligament. Then here on the anterior aspect, ventral sacroiliac ligament, dorsal aspect, posterior dorsal sacroiliac ligament, and between the transverse process of L5 vertebra and ilium there is a iliolumbar ligament. Now truly speaking, the two sacroiliac joints are the strong and weight bearing joints. So it consisting of the two components. One is anterior aspect, there is a plain variety of synovial joint between the auricular surface of the ilium and sacrum. And on the posterior aspect, there is a syndesmosis type of joint between the tuberosity of the sacrum and ilium. Now we discuss the ligaments one by one. First is the intraosseous sacroiliac ligament. This one is the intraosseous sacroiliac ligament. It is the second strongest ligament in the body and connects the irregular bony tuberosity of the sacrum and ilium behind the auricular surface. This one is the auricular surface or articular surface. Behind it there is a attachment of the intraosseous sacroiliac ligament. Then ventral sacroiliac ligament. So here it can be seen anterior sacroiliac ligament. This one is the ventral sacroiliac ligament. So that connects the ala of sacrum as well as pelvic surface of the sacrum with the adjacent part of the ilium. That is the ventral or anterior sacroiliac ligament on each side. Then come to the dorsal sacroiliac ligament. This one is the dorsal, this rim in rim-like ligament, dorsal sacroiliac ligament. So it is made up of strong fibrous band which connect the posterior superior iliac spine of ilia with the intermediate sacral crest. Intermediate sacral crest. Then iliolumbar ligament. Iliolumbar ligament can be seen here. It extends from tip of transverse process of L5 vertebra up to the ilium. That is the iliolumbar ligament. So these are the ligaments which strengthen the sacroiliac joint anterior aspect as well as from the posterior aspect. Now from the posterior inferior aspect, there are another two ligaments are there. So this diagram showing the anterior sacroiliac ligament, both sides. Strengthen the sacroiliac joint right and left from the anterior aspect. This one is the posterior sacroiliac ligament. Deep to this there is a intraosseous sacroiliac ligament that overlies the intraosseous sacroiliac ligament. Now this diagram showing this one is the ventral sacroiliac ligament from ala of sacrum and pelvic surface of sacrum to the adjacent part of the ilia. This one is the iliolumbar ligament from transverse process of L5 vertebra to the ilia. Now from the posterior inferior aspect, another ligaments are there, that is the sacrotuberous ligament and sacrospinous ligament. Now what is sacrotuberous ligament? It is a strong fibrous band of the fibrous tissue. It has broad upper medial end and narrow lower lateral end. So upper end is attached from above downward to the posterior superior iliac spine. This one is the sacrotuberous ligament. Okay. So upper end is attached from above down to the posterior superior iliac spine, the posterior inferior iliac spine. Yes, posterior superior iliac spine, posterior inferior iliac spine, then lower part of the posterior surface and lateral border of the sacrum adjoining upper part of the coccyx, while lower end is attached at the medial margin of the ischial tuberosity. Here, it is attached to the medial margin of the sacral ischial tuberosity. Some of the fibers from the lower end are continue onto the ramus of the ischium. Continue onto the ramus of the ischium that form the falciform process. Next to this is the sacrospinous ligament. This one is a sacrospinous ligament. It is a triangular sheet of fibrous tissue with its apex directed laterally and attached to the ischial spine and base is directed medially and attached to the side of the sacrum and coccyx. Now sacrotuberous ligament and sacrospinous ligament converts the greater and lesser sciatic notches of hip bone into the greater and lesser sciatic foramina. So these are the two important exits of the pelvis. So this is articulation between the sacrum and irregular articulation. So here this greater sciatic and lesser sciatic foramina formed due to the sacrotuberous ligament and sacrospinous ligament. So this ligament prevent the upward tilting of the sacrum. Upward rotation of the sacrum are prevented by these two ligaments. Now stability of the sacroiliac region. Sacrum hangs from the sacroiliac joint, forming the posterior wall of the pelvis. Now body weight tendency having to cause forward rotation of the upper end of the sacrum as well as concomitant backward rotation of the lower end. So ligament which resist the forward rotation of the upper end of the sacrum are the intraosseous sacroiliac ligament and posterior sacroiliac ligament and iliolumbar ligament. While ligament which resist the backward rotation of the lower end of the sacrum, or we can say prevent the upward tilting of the sacrum, that is via sacrotuberous ligament, sacrospinous ligament and sacrococcygeal joint. Now, so these are the stabilizing factor of this sacroiliac region. Now, this diagram showing the pubic symphysis, there is a disc, fibrocartilage disc between this hyaline plate of the pubic bone. This one is the sacroiliac joint. This one is the intraosseous sacroiliac ligament, dorsal sacroiliac ligament, ventral sacroiliac ligament, sacrotuberous ligament, and sacrospinous ligament. So all these ligaments will strengthen and stabilize the sacroiliac joints. Now, sacrococcygeal joint. It is a secondary cartilaginous joint between the apex of the sacrum and the base of the coccyx. Now, bones are united by the thin intervertebral disc is there. So, sacrococcygeal joint is strengthened by the presence of the ventral and dorsal. Here there is a presence of ventral and dorsal sacrococcygeal ligaments and intercornual ligament which connect the cornu of the sacrum and coccyx. Cornu of the sacrum and coccyx. Now, coccyx moves a little backward during defecation as well as parturition. So, this is about the sacrococcygeal joint. Now, clinical correlation of this joint. First is the prominence of the hips in multiparous female. So, during pregnancy, particularly in the last trimester, the pelvic joints are relaxed by the hormone relaxin to provide smooth passage of the baby. After childbirth, these ligaments tighten up again and but never regain their original efficiency. So what can occur? Pelvis widens and hip becomes more prominent in case of multiparous female. And second one is the gait in the late pregnancy. The body of the fifth lumbar vertebra makes an angle about 120 degree with the sacrum. The angle is called as a lumbosacral angle and it opens posteriorly because intervertebral disc between L5 and S1 is thickened anteriorly than posteriorly. So forward tilting of the upper end of the sacrum due to weight is prevented by the presence of the nearby ligaments. And in case of during last trimester of the pregnancy, due to relaxation of the ligaments and additional body weight due to gravid uterus, upper end of the sacrum tilts forward during walking, and woman has tendency to fall forward. But this can be prevented by the walking with backward tilt of her lumbar vertebral column and shoulders. For example, she walks like a lord. This diagram showing there is a body weight from the vertebral column is transmitted to sacrum, that is passes anterior to the axis of rotation of this at the sacroiliac joint. This is the axis of the rotation occurs at the sacroiliac joint, and this one is the body weight. So that passes anterior to this. Okay. So hope you understood very well. So this is about the joints of the pelvis. Thank you.